Hello everyone, I'm Mike Sharf. I'm the Chief of Child and Adolescent Psychiatry at the University of Rochester's Golisano Children's Hospital in Rochester, New York, and I'm also one of the consulting psychiatrists and faculty with Project Teach in Region 1. I want to talk to you today about one of the challenges that youth and families are facing in the context of this COVID-19 crisis. And it's something that may not be intuitive to all of us, but unfortunately it's a reality we need to recognize and face. And that's that during this time, while we can all understand it's stressful, a number of us are having to deal with things that may not be typical for us. Children are facing the loss of friends and school day-to-day contacts, of activities that they used to find joy in. Many students and teens are facing the loss of specific activities like high school graduation, prom, school plays. In the context of the changes and challenges that kids have had to deal with, and parents, it's not surprising that people are under more stress. Unfortunately, this has resulted in something we've seen over the past few weeks, which is an increase in the number of intentional ingestions of people taking medication, both prescription and over-the-counter, either impulsively or in a planful way to hurt themselves or even to try to kill themselves. During this stressful time, those of us who are the adults in the household just need to make sure we secure the environment. With younger children, it's normal and understood that parents need to know where toxic substances, from things we use as cleaning agents to medications, are in our house, and secure them so that little kids don't have access to them and unintentionally ingest them in a way that could be harmful. So this is a time now, with all of us at home more for a greater period of time, that we need to take the same level of caution for people in our house, for children of all ages, and in particular for anyone who has a history of challenges with depression, suicidality, self-injurious behavior, or even impulsivity, because sometimes in high levels of stress, conflicts can happen and people can unfortunately do things which they might regret immediately after they do them. But we need to make sure that we keep our environment as safe as possible so that even when these times of conflict and stress happen, people are still safe. There's resources on this website for how to secure medications in your home if you need assistance with that. There's also information on this website about, if you're a parent, through your pediatrician or primary care provider, accessing appropriate mental health support and guidance during this crisis. And if you're a pediatrician or other primary care provider yourself, our Project Teach services continue to be in operation, being able to provide referrals to mental health services, as well as consultation with child and adolescent psychiatrists Monday through Friday at our routine hours by calling our toll-free line. This is a very challenging time for all of us. I am confident that by pulling together in the same ways that I'm already witnessing in families and communities and among healthcare providers, we can support each other through this crisis. Be well.